Today, myself and my fellow students are here to speak about natural childbirth. There are many reasons why mothers choose to deliver their child naturally, and with that, many benefits. In natural childbirth, no medications are used throughout the labor. The mother utilizes different techniques to promote comfort and complete the delivery as quickly as possible. Today, we are here to teach you about 3 different methods, which encompass the idea of natural childbirth and also demonstrate specific relaxation techniques that will assist you in your natural childbirth. For some women, natural childbirth may not be an option. High-risk mothers, who include women over 35, teenage mothers, history of high blood pressure, diabetes, or chronic disease, might need in-depth monitoring and additional measures that can only happen at a hospital. First method that we're going to speak about is Dick Reed. Dick Reed was a grandfather of natural childbirth. He wrote the book Childbirth Without Fear. His synopsis was that if a lady that was pregnant knew exactly what changes that her body would go through during the pregnancy and deliver, she could do so with a reduced level of pain more quickly and without being fearful. Very quickly, I'm going to just go through the different stages of labor and then the birth. It's divided into 4 stages. In the first stage, the mother feels contractions. These contractions will feel like heavy cramps, your abdomen will tighten. This helps the cervix soften, opens the passageway up, contractions get stronger. When you come out of this stage, right before you're in transitional labor, at this point when this one ends, you will be dilated to 10 centimeters. That ends stage 1 and you go into stage 2. Beginning of stage 2 happens. You feel the urge to push. The baby is pressing against the uterus. It's vital to listen to your body. The baby is also going to make special movements to expel. Push when you feel the urge and practice breathing techniques. It could last anywhere from 45 minutes to 2 hours. Stage 3 is placenta delivery. There should be no pain and it should deliver no more than 20 minutes. The best part at this point will be the recovery stage. You will bond with your child and rest.
The Bradley method was developed by Dr. Robert Bradley, an obstetrician who endorsed natural, non-medicated labor and childbirth. He advocated for partner involvement as the birth coach and educated coaches in techniques such as massage and deep breathing for the mother's comfort. Dr. Bradley believed that labor is a happy time to be shared with both parents who work together as a team. The Bradley method encourages women to focus on the positive feelings of childbirth and to tune into their bodies. Dr. Bradley believed that women are entitled to dignity in childbirth and that self-control can be as effective as medication in controlling labor pain. He also believed that medication during childbirth is dangerous to both the mother and child. If you plan to utilize the Bradley method for delivery, you should expect to have a natural, dignified, non-medicated birth with great involvement of your husband or partner as your birthing coach, and a joyous climactic birth uninterrupted by medications or anesthesia.
Lamaze includes Dick Reed and Bradley. The thing that is stressed during Lamaze is to have support. Know your birthing process and relax. There's many relaxation techniques. Support is very important. Have a partner that's very attentive, that does relaxation techniques with you, and you all learn together before the birthing experience. We'll now discuss techniques. Breathing, very important. Exhale longer than inhale. Breathe in, breathe out. Relax. Panting, minimize the strength of the contraction. It decreases your pain. Walking, very important to move around during labor. It relieves pressure and pain, and the speed of the delivery will speed up. It will help you along. It will go much quicker, even with a first-time pregnancy. A birthing ball or the side of the bed can be very useful to get you in a different position that relaxes your back and helps the birthing process. Positioning. I recommend the position that makes you the most comfortable, and most of all, have a supportive partner. Yes, ma'am.
Can I get in the position where I'm like squatting like this?
Oh, that's very good. That helps the cervix ripen and brings the baby down through the birth canal.
What should I do if my water breaks at home?
Call your doula or your midwife. Or some people even have a midwife or a doula instead of a home birth. They combine that with a visit to the hospital, and it's all combined for them. They just leave out the medications.
So if you have to drive to the hospital after your water breaks, would you use the panting breathing techniques?
It depends on whether or not you need to bear down. If you feel that the birth is imminent, by all means.
In conclusion, we have presented 3 different methods. A certified midwife, a natural childbirth center, or a doula can discuss these methods and others in depth. These methods subscribe to a normal birth process where the woman uses her own instincts and body signs during labor. Hopefully this information will enable you and your partner to make an informed choice about natural childbirth. Whether or not you choose to incorporate any or a combination of all 3 of these types, at least you are better prepared for the birthing experience.